Well, we all want to feel better. We all want to look better and look younger, too. So it's great that we have Dr. John Dempster here, a naturopathic doctor, to tell us how we can do just that. And we're not talking about going under the knife, but we are going to do some interesting things with needles, apparently. You're going to tell us all about that. So you find that you can heal the body and make the body look great and look younger with nutrition?
Well, nutrition is the foundation. It's so important. It's what makes us look and feel great. And one of the key concepts we talk about at my clinic, it's not about anti-aging, it's about optimal aging.
Ooh, what's the subtle difference?
Well, the difference is we're all aging. We can't anti-age, but we can age well, and we can age better.
Well, and it's interesting you say that, too, because the people who try to look younger, they don't achieve that, really. But if your goal is to just look awesome at any age, right, that's easy to do, right?
Absolutely. If you take some proper measures and you start to address some of the key concepts that are going on in your body.
What is aging us prematurely?
Right now, it's a lot to do with lack of key nutrients, and the key word are antioxidants, and this is what we get in a lot of our fruit and vegetables. So they're so important. You know, we've all heard as a young kid, you know, eat your fruits and veggies. Do we eat 10 servings a day? No.
Well, and I've also heard that even if you do manage to get that many servings in, the fruits and vegetables themselves don't have as much nutrition in them as they used to. So
it's a big problem. They're coming across countries, they're sitting on trucks for 2 weeks, and they're sitting on the shelves for another 2 weeks, and they're losing their antioxidants, their key nutrients. And so the healthiest people that I know, they not only eat well, but they supplement well. So you've got to start.
Whoa!
Well, we've got an iPad down.
So supplementation is important.
Yeah.
We see all these products. There's a wall of products at the supermarket. We see that, right, but is that where we should be buying our supplements?
No, it's not a matter of buying what's being featured that week or what the trendy topic is. It's about understanding what your body needs. This is the big difference. We're all unique biochemically. And so what we do a lot of is we do a lot of analysis and we do a lot of diagnostics to understand what your body would need versus what mine would need, and then do a target supplementation program from there.
And that is the best way to go, because then you can really tailor it to each person.
Absolutely.
So what did you bring with you today?
Well, I just brought a couple of items, a couple of key products that can help along the way. And one of our most popular treatments that we do at our clinic is we do a lot of vitamin injections and IV infusions, and we do this for a number of reasons, but a large number of people are very chronically deficient, and either they don't like to take a lot of pills or they're not having a good absorption pathway, so we need to bypass that. We need to bring those nutrients straight into the system.
That seems like so old school medical, to be hooked up to an IV, and yet here you are, a naturopathic doctor, doing that.
Yeah,
cool. So these vitamins are going right into the bloodstream.
Exactly, and they're very safe, they're very natural, and again, they can be very helpful for helping people who are feeling burnt out, looking a little weathered, fighting serious illness and chronic illness, and really help to be part of their recovery plan.
Hey, when would a good time to do that be? Before the flu season or something?
Any season.
Okay.
It depends what your goals are, and if you're trying to stay healthy through the flu season, there's a number of safe and effective things you can do at home as well, but these are also a great, what we call a boost to get things going.
Great. Okay.
Another big concept we've got here is detoxification, and this is a huge issue right now. It's also it's a big buzzword. A lot of people are always asking me, what's the best detox? What should I be on? What should I be taking to detox my body? Well, once again, we're so different. We've got to understand what parts of the body should we be trying to clean.
That's true. I've heard there's a liver detox, there's a bowel cleanse, then you've got gallbladder and all of those other things. How do you know where to start?
Well, they're all very important. They're extremely crucial parts of all of us, but we've got to start looking at each person and going through the proper workup to understand, all right, is this person's kidney not functioning properly? Is their liver a little bit overwhelmed? And that's one of the first couple areas. Is the colon blocked up? Constipation is rampant. And if we're not removing the material in the waste, we've got to start to get that rolling right off the bat. So,
what would cause our liver, for example, to become overburdened?
Well, we live in a toxic soup. In Toronto and in most cities, we live in a toxic environment. And whether that's what we're breathing, what we're eating, what we're drinking, and the stress that's in our daily life, this is huge.
And our liver has to deal with all of that?
Your liver is the first organ that starts to break things down to get out of the body.
Wow. And junk food, I hear, is just as bad for your liver as alcohol.
Well, junk food can be, it can rip your body of key nutrients, and it can also plug your liver right up so it can't focus on some of the other more important toxins, perhaps.
Wow, so that powder is a detoxification.
Yeah, this is
tool.
just one of our tools that we use, but this is a concept called a medical food, which will bring in a large variety of different liver cleansing nutrients and makes it very easy for the patient to work with.
Oils, we hear a lot about essential fatty acids. Do you agree that they're important?
Absolutely, yeah. One of our key aging concepts in our body is inflammation, and a lot of us have an omega-3 deficiency, and this can be done through some important tests, but one of the things we want to do if we want to slow the risk of cancer or heart disease or even just keep our skin looking great, we want to slow down inflammatory processes. And omega-3s found in fish oil are very, very common and very helpful.
Well, that's interesting you say that, because on the cereal boxes, everybody's claiming to have omega-3,
Right.
but it's not nearly as good as what you get from fish, right?
That's correct, yeah. And the problem, we've got to be careful with just eating fish because now we've gone and contaminated our oceans for a large part. So
we got mercury concerns.
So it's important when you're taking a fish oil to make sure that it's been properly screened and cleaned, and that's what the professional level brands do.
How much do we need to take a day?
It all varies depending on the person, and it depends on the dose. Each product is so different, so there's no one magic dose for everybody, so we do take that into consideration.
Anything else we need to know?
We need to talk about stress.
Yes!
Right? We're living fast-paced lifestyles, and it's not about changing your job or changing your career. And some people, possibly it would be a good idea, but it's about managing that stress. You know, we're not sleeping. We're going to bed after midnight, most of us. Did you know that each hour you get before midnight, you actually get double the benefit?
Do you know, I'd heard that. So the earlier you can go to bed, the better, even if you have to get up early, right?
That's right. If you get up early, that's great. But if you're going to bed at 10 o'clock at night, your growth hormone, which is your anti-aging hormone, secretes at a larger amount.
See?
These are important things that we don't listen to our bodies.
This is good takeaway information. Thank you.
You're very welcome.
And if you want more information, this guy's got some good stuff. TheDempsterClinic.com. So now here's some more information on Dr. John Dempster.